From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, those of you as far west as Jackson, Tennessee. What up, Madison County? This is your host, Dr. Sean Pruitt, and this is Pharmacist on Call. And if you are watching this show, that's right, I'm your community pharmacist. So welcome everyone to the July edition of the show. For those of you who this is your first time looking at the show, this is your 1 hour forum. This is where you get to call me and ask me questions live on the air, and hopefully, based on a little bit of knowledge that I have and a thorough explanation by you, we can come up to a solution to fix your problem. Just wanted to get into some birthday shout outs briefly here. We've got my cousin Michelle Daly Garcia, who is getting ready to turn, I'm not going to give her age away, but happy birthday to her. Happy belated birthday to my nephew. We call little Artie, but he is Artie Leroy Thomas Jr. And happy birthday to a good friend of the pharmacy and the water store, Sheila Garner. Happy birthday, Sheila. Wanted to also say a happy belated birthday to siblings, Roger Garcia, little Roger, and Sierra Garcia. They're all my cousins. They are actually Michelle's children. So happy birthday to everyone. And last but not least, the second coming of me, Sean Pruitt Jr., my son, will be 6 on July 29th. So Boss Hog, happy early birthday. Wanted to also give a shout out to those at the Heimerdinger Foundation. The wife of the former coach, the late coach, Mike Heimerdinger, has formed a foundation that provides healthy meals for people who are battling cancer. So we are their water sponsor. So we supply alkaline water, Kangen water, with those meals to help alkalinize the body for those patients who also receive those meals. So wanted to send a big shout out to Catherine Ray, who is the executive director there, she and her husband, and I thank you for the opportunity and the honor to help sponsor your water there. Miss Robin Mazur, Susan Poteet, and also Laura Rodriguez. So big shout out to the staff over there at the Heimerdinger Foundation. Also wanted to get into some news. Of course, you know, there is well, let me give another set of shout outs here to our water customers. The water business has really picked up. In fact, shout out to our customers who drive all the way from Cannon County, from Smithville. They came in this past Sunday with 40 gallons for us to refill. So my staff was really happy about that. So thank you for supporting the store, and you all certainly for spreading the word about the benefit that it's having for you. All of you who come in from Bowling Green, Kentucky, Russellville, Clarksville, Smyrna, Murfreesboro, gosh, just from some of every McMinnville. A big shout out to all of you who drive so far. Oh, Columbia, I'm sorry, Murray County, big presence in Columbia there. So thank all of you for keeping the water store successful. Did want to get into some news, some healthcare policy. As you know, we have an opioid epidemic in this country, and not sure how to tackle it, but well, the FDA, as of June the 6th, the FDA requested the removal of the drug Opana ER, better known as oxymorphone, or yes, Opana ER. So the reasoning behind that is the drug was reformulated because people were crushing the drug up and snorting it and injecting it. So they reformulated the drug a few years ago, removed activists who I guess did not have a reformulated version, and this was supposed to be safer. So what they found is that the incidences of people injecting and snorting did not decrease. In fact, what they noticed, there was an uptick in spread of HIV and a hepatitis C outbreak because of the needle sharing piece. So the FDA, I guess, formally submitted a request for Endo, who is the pharmaceutical company that manufactures Opana ER. And I'm sure Global will probably get a letter too, since they manufacture the generic oxymorphone ER, to remove this drug from the market for health and safety concerns. So a month later, July 8th, Endo responded and has agreed to voluntarily remove Opana ER from the shelves. Basically, they came to an agreement. I guess the advisory board, they voted 18-8 to remove this, I guess, in light of the data that they saw. So it really wasn't a hard decision to make. So kudos to them for pulling something off of the market that they saw may be potentially harmful to the public. This is going to be from my understanding, a slow transition off of the market. So for those of you who are patients on Opana or oxymorphone, yeah, it will be leaving the market. When we don't know. Sometimes these things are strange. Sometimes they are overnight and you've got 30 days to remove it. But so far it looks like we're still able to buy the drug. So I think that they are working with the FDA to come up with a smooth transition for removal of the drug from the shelves. Just wanted to also talk a little further about the opioid epidemic. It affects so many different people, and I know that the tendency is to judge people who are addicted to drugs. So I just kind of wanted to briefly give you all, I guess, a chemical description of what's going on with your family member or someone you know, or just a person on the street with what's going on with them. Just in general, these opioids are addictive. They are physically addictive, and so when a person takes these meds, the body becomes dependent over a period of time. And so it is not that the person enjoys taking the drugs for the effect. Well, they may initially, but once you try to come off, the body will go through what's called a withdrawal symptom, and that will manifest itself as fever, chills, flu-like symptoms, nausea, diarrhea, depression. And so in order for you to get back to some sense of normalcy, you will need to continue to take this drug. And so they become a slave to it. And the number of people that I have seen, going through withdrawals, it's not because they want to be on this drug. It is because they have no choice, because they don't want to go through that sequelae of illnesses that come along with opiate withdrawal. In fact, there was a study also talking about the incidences of opiate addiction and mental health, and I believe that the study was done in University of Michigan, stated something like 16% of the country is dealing with some sort of psychiatric disorder, be it depression or anxiety or bipolar disorder. Personally, I'd agree. I think the numbers are actually higher than that. But what they were saying is that even though they are 16% of the population, they make up 52% of the people who are getting chronic pain medication. So my guess after reading that is that I know that these drugs affect the brain chemistry. So things like your opioid families, your alcohols, everything pushes up dopamine. And if you know anything about schizophrenia, bipolar disorder, any of these, it's a situation caused by having too much dopamine produced in the brain. Well, these drugs add to that, so they augment the effects. So it makes sense that people on these drugs are also going to have a concomitant psychiatric disorder. So I just found that very interesting. But just to get into the show itself, this is your 1 hour forum. This is your opportunity to call in. And with those health questions, we know that your doctors and your pharmacists are busy. They don't have time for this hour. I do. So for those of you who are wondering who I am and what this show is about, I'm Dr. Sean Pruitt. I own Pruitt's Discount Pharmacy and the Kangen Water Store of Nashville, and we are Nashville's only, Middle Tennessee's only discount pharmacy, offering the deepest discounts for those who are uninsured and those who are insured, but your price of your medication may just be too high. We are also the Kangen Water Store of Nashville. This show is our service project to you, where we take an hour of our time every month to answer questions for you, because we understand that your doctors, they may give you the 15 minutes and they may not even listen to you. Here you will be listened to. So call in with your questions or your comments. Looks like we are up on our first break, so you all stay right there. If you have any questions, feel free to call in.